Welcome to Lesson 2 of the MUIH, Professional Continuing Education course, Nutrition for Cancer Prevention. I'm your moderator and faculty for the course, Jason Bosley-Smith, and today we're launching into the second part of our course, shifting from general recommendations around diet to dietary patterns that are associated with decreased cancer incidence and risk reduction. So we'll start off by talking about the Mediterranean diet as our first dietary pattern. But let's define the Mediterranean diet and determine and outline some of its compositional components, what makes up the Mediterranean diet, and then we'll, from that point, be able to dive into some of the mechanisms by which the Mediterranean diet's features, its composition, actually may be causative for a risk reduction of cancer. So to highlight some of the main points, the 5 main compositional components around the Mediterranean diet, number 1 would be a high intake of mono and polyunsaturated fats, so dietary sources including higher intakes of things like avocado, olives, and olive oil. Number 2 feature of the Mediterranean diet would be a greater proportion of fish, constituting a higher omega-3 fatty acid intake. The number 3 component of the Mediterranean diet would be its high dietary fiber intake, primarily consisting of a number of whole grains. Number 4, the Mediterranean diet includes a high intake of fruits and vegetables. And finally, number 5, the other aspect of the Mediterranean diet is that it's generally lower in sodium, saturated fat, and refined carbohydrates. So let's look at the science a bit, and let's look at some of what the literature kind of shows us. And here we see that the Mediterranean diet and the systematic review of over 2 million subjects show that a strong adherence to a Mediterranean diet was inversely associated with cancer mortality and risk of several types of cancers: colorectal, breast, gastric, liver, head and neck, gallbladder, and biliary tract cancer. So clearly this is a very large database or sample size to pull from, 2.1 million subjects in this systematic review that showed the features of the Mediterranean diet reduce cancer mortality. The Greek cohort of the EPIC study revealed that the inverse association between adherence to a Mediterranean diet and cancer risk is not due to any single component of the diet, but rather an effect of the complete pattern. So it may be that we're not looking just solely at, again, one individual component. There's a synergistic effect. There's the considerations around how these different nutrients that constitute the Mediterranean diet may work with one another to provide, through their different mechanisms, a robust cellular and overall chemopreventive properties and protection, really. So what are some of these mechanisms that may be at play here? So we can gather from the dietary compositional components and aspects of the diet what may be these underlying features. So number 1, the intake of fruits and vegetables that we just mentioned a minute ago have a number of different benefits mechanistically that may be at play here in this decreased cancer mortality or reduced risk. So number 1, anti-inflammatory effects, the effects on cellular redox, the endothelial function, improving endothelial function generally, improving broadly metabolic processes, and contributing to healthy weight management. And as we talked about in Lesson 1, higher weight levels, BMI being increased, and higher levels of obesity are associated with an increased risk of cancer by a number of mechanisms themselves. Number 2 mechanism here with the Mediterranean diet may be that composition of fiber and the whole grains that are comprising the diet and the fiber intake, that they largely are probably binding and neutralizing these potentially carcinogenic compounds. So being able to help sort of excrete through that higher fiber intake carcinogenic compounds. Number 3, another mechanism that may be at play here, is the omega-3 fatty acid intake, which we mentioned that a higher amount of these poly and monounsaturated fats, higher amount of fish intake, so a higher amount of anti-inflammatory omega-3 fatty acids, and that may be lending itself to really being a number of benefits here. Number 1 being inhibiting growth, being pro-apoptotic, so reducing that cancer cell's ability to evade apoptosis, and then being anti-angiogenic, so reducing that development or the ability of those cancer cells to develop new blood vessels. And finally, the tree nuts, the component where there's a higher amount of nuts in the diet, and tree nuts specifically having an anti-inflammatory effect, having some antioxidative properties, and then again, protective of the endothelium. Number 2 dietary pattern we'll look at with the reduced risk of cancer or cancer incidence is the ketogenic diet. And of course, the ketogenic diet right now is very popular and is being investigated not just for cancer prevention, but really in cancer treatment as an adjunct to conventional therapies. So the ketogenic diet, again, just to give some definitions and parameters around that, is essentially designed, the classic ketogenic diet, as a 4-to-1 dietary ratio of fats to proteins plus carbohydrates. That ratio, and there's variations on that ratio. The modified ketogenic diet is typically a 3-to-1 ratio or 2-to-1 ratio, the fat content being the 3 or 2 to the protein and carbohydrates being the 1. The MCT, or medium chain triglyceride ketogenic diet, is characterized less by the ratios and more by the percentage of dietary fat of MCTs being augmented in the diet with usually some sort of supplemental medium chain triglyceride, and then with the protein and carbohydrates. So usually in that case, it's about a 75% dietary fat intake, roughly 10% of medium chain triglycerides being augmented or supplemented into the diet. And then a 12 to 15% protein intake, and then 5 to 8% roughly carbohydrate intake. But importantly, it's something to highlight, particularly of patients that are looking from a dietary perspective or looking at the ketogenic diet, is that it really should be a mixed fatty acid profile. My experience working with patients and even discussing this with other clinicians is that there's often this idea that it's purely some of the more saturated fats, high amounts of bacon, butter, and these types of saturated sources, versus having a nice complex array of mixed fatty acids. So having monounsaturated, polyunsaturated, certainly saturated fat can be a component of it, but want to have a sort of a blend of those different fat intake sources. And just a couple highlights about the ketogenic diet, and again, where it may be playing into a role of cancer prevention or chemoprevention mechanistically. So the strongest treatment evidence is in glioblastoma. And that's really, that specific brain cancer type has been associated primarily with the best response to the ketogenic diet. A number of mechanisms may be play there. There have been both cell line and mouse models that have exhibited anti-tumorigenic properties through the ketogenic diet as well. The challenges, though, somewhat with the ketogenic diet have to do with, again, the heterogeneity of the existing studies. So as we just mentioned in the previous slide, there's a number of different ways you can approach the ketogenic diet in the different ratios, the different outline of dietary fats, and factoring other things that would affect the body's ability to get into ketosis, and things that influence glucose metabolism. So all these different things that need to be factored for confounding variables do pose some challenges to studying and research of the ketogenic diet in the context of cancer and frankly, in a number of other different types of conditions as well. And then finally, with the ketogenic diet, really want to look at the cellular metabolism that might be in play. That may be one of the mechanisms by which the ketogenic diet is providing some benefit, is that redox status and cellular metabolic status shifting from essentially glucose metabolism primarily to fatty acid and ketone metabolism, and decreasing that glucose load. And as we saw in the previous lesson, that high glycemic load that is characteristic of a much higher carbohydrate diet, particularly refined carbohydrate, is associated with some degree of increased risk. And the recommendations that we talked about in lesson 1 would be to decrease glycemic load and glycemic intake broadly, and certainly the ketogenic diet would help achieve that. And so here a slide with just a series of studies just to show as of November of 2018, the number of clinical trials that were underway investigating the ketogenic diet in the context of cancer. Some of these are in current cancer patients. Some of these are looking forward into how the ketogenic diet may be chemopreventive. But as you can see from the slide, there's certainly quite a number of studies and interest in the research realm around the ketogenic diet for its potential chemopreventive properties or chemoprotective properties. And again, so now what might be some of the mechanisms that are at play here? So we've got a number of things that ketones can provide. So the ketones themselves, as we begin to generate more ketones through the process of nutritional ketosis, they have an anti-inflammatory effect. They may certainly influence cellular energetics, like we just talked about a minute ago. They influence and benefit some of the metabolic processes that would be, again, kind of prohibitive to cancer development. They certainly can, and many of the studies have shown that there's a benefit to weight management and weight reduction on the ketogenic diet, and reduce reactive oxygen species. So just by the nature of general cell metabolism, we'll see some reduced free radical production through ketogenesis and ketones themselves. On the other side, so that's the benefit of what happens when we have increased ketones. What mechanistically may be the benefit around carbohydrates and reducing them? So there's a reduction in the tropic or proliferative signaling, so the less signaling of insulin and IGF-1, reduced substrate for glycolysis, so tying back to the Warburg effect, that upregulation of glycolysis and that glycolytic flux is certainly going to be influenced by a reduction of the substrate of carbohydrate in the diet. Okay, so now for our academics to application exercise or question. Now that we've gone over a couple of different dietary patterns that have some chemopreventive properties and seem to have some evidence to support their benefit in cancer prevention or risk reduction, we'll look at personalized nutrition. So in this exercise, personalized nutrition requires individual assessment of each patient and selection of appropriate intervention based on a thorough review of health history, medical diagnosis, comorbidities, lifestyle factors, health literacy, and biomarkers. While the ketogenic diet has proven efficacious in some cancer types, it may not be prudent in certain situations. For the exercise, you're to list any types of caveats to the diet that should be considered with individuals that are looking at the ketogenic diet and identify patient populations for which the diet may not be appropriate. Okay, and for our last series of slides around dietary patterns in this lesson that have a relevance to cancer risk reduction, cancer prevention, we're looking at caloric restriction. So by definition, let's kind of provide this framework. Caloric restriction looks at and is defined by an 80% intake of caloric needs based on basal metabolic rate, so reducing about 20% off of where someone should be based on their BMR. Some of the different factors here that may be at play, again, mechanistically, there's certainly going to be a reduction in insulin and IGF-1. We mentioned that as part of a carbohydrate restriction, but that certainly holds true here because it's a caloric restriction across the board. It may be influencing the mTOR pathway. So mTOR pathway associated with growth, proliferation, and reductions in the mTOR pathway or an inhibition of the mTOR pathway does show some association with reduced tumor burden or the potential to reduce carcinogenesis and those processes of proliferation. Caloric restriction appears to upregulate autophagy and mitophagy, so the more or less sort of recycling or sort of cleanup of cellular debris and mechanisms in both the cell itself and then mitophagy within the mitochondria. Caloric restriction does appear to reduce mitochondrial-induced reactive oxygen species owing to that reduced cellular metabolism, so downregulating kind of slowing cellular metabolism, less metabolic byproducts, therefore less ROS or oxidative stress on the system. And there's a lot, of course, of investigation and interest now in caloric restriction mimetics. So whereas caloric restriction, again, may be appropriate in some populations, and there may be ways that patients can be counseled to incorporate that, there are these mimetics that have been developed, probably most famously by Dr. Walter Longo, and these mimetics can be developed as part of a plan that, again, already some of the research seems to point to some, at least mechanistic components that would be associated with risk reduction of cancer. And in preclinical studies, animal models and epidemiological evidence all point towards caloric restriction as being associated with risk reduction of cancer. And so here's a final slide that really just shows, again, some of the different mechanisms at play here. We have in the center of the slide here the caloric restriction fasting or fasting mimetic diet, FMD, and the arrows kind of pointing out to the various different effects that those may have on the system. So seeing some normal cell reduce normal cell toxicity, reduce side effects that we're talking about more, possibly in the context of treatment, but you see upregulation of autophagy, upregulation of senescence, cell senescence, cells that have been damaged to be, again, brought through a process of apoptosis appropriately, decreased regulation of growth and other growth or proliferation pathways. In the top right-hand corner, the tumor cell, increased sensitivity to anti-mitotic agents. So again, these may be places where the caloric restriction component of the diet may be augmenting and be an adjunct to an existing chemotherapeutic or conventional cancer treatment. Of course, this would be in the context of a patient with cancer versus just strictly cancer prevention. But when we look at the mechanisms, we can sort of, again, extrapolate out that some of these things, of course, may play the same benefit in a patient without cancer to provide those same sort of proactive or prophylactic benefits. In the bottom left-hand side, you can see circulation-wise, a decrease in a number of growth regulators, leptin, adiponectin, VEGF, some interleukins and cytokines, decreases in insulin and glucose that we know, again, tend to be tropic in nature, an increase in ketones, so owing back to sort of that idea of nutritional ketosis in the ketogenic diet that we talked about a few slides ago. And then the far right-hand side, effects and influence on the tumor microenvironment. So decreasing T regulatory cells, decreasing inflammation, increasing cytotoxic T cells. So again, that kind of owing more to in the area of a cancer process or a cancer patient, improving drug delivery, increased tumor clearance. So having some mechanisms that clearly play a role not only in cancer prevention, but as part of what would be an adjunct in cancer treatment. So let's tune in next time and join us for Lesson 3, where we'll shift into specific nutrients and how they have, in the literature, shown evidence of cancer prevention and support as well.